Hi class. So today for this topic I will be using appendicitis and ignore my shirt. Anyway, the reason why I choose this is because it's not like I have had it before, but my husband has had it. So I just choose based on his experience, and he had he had to get his appendix taken out when he was 14, I think, or 12. Well, it doesn't matter. Yes, I like to do uh disorders, diseases that I'm familiar with. That way, I know what I'm saying. Okay, so what's appendicitis? It's the inflammation of the appendix, and this is a small pouch attached to the large intestine, and some symptoms and signs of appendicitis, and this usually happens between 24 to 48 hours of your appendix like hurting and stuff. So like this is a disorder that uh, progresses fast and it's really painful. The first sign is abdominal pain, and it usually is the first symptom. It starts in the belly, like where your appendix is, and bottom, shifting to the lower right side. It gets worse with coughing, walking, making jarring movements. Then digestive issues, loss of appetite, nausea, vomiting, constipation, diarrhea. And other general signs are like low grade fever, abdominal bloating, and the inability to pass gas. And then we have appendicitis requires immediate medical evaluation. Um, Appendicitis requires immediate medical evaluation to prevent the appendix from bursting. And usually what they do treatment options is an appendectomy is when and this is the most common treatment, and is surgically removing the appendix. And this can be done as a minimal invasive procedure, but if you get to the point where like your appendix bursts, they're gonna have to cut you open, and that's what happens to my husband. Apparently he was like in a lot of pain, and he lasted for like a day, and when they took him to the hospital, his appendix had just burst, and he had to have it, and he still has a big scar on his abdomen. Anyway, uh the appendectomy is usually the first option, and like it usually doesn't take that long, and now we like um technology advanced. Now they can do a tiny cut, and with the camera getting it out unless like your appendix burst. And then we have in some mild cases we have they use antibiotics to while they're preparing you for surgery. If you get there like right when you're like it doesn't have anything, like it's not bad. And then I decided to do some fun facts or facts about the appendix. First of all, you don't need it. The appendix has no known, like nobody knows what it is for, but like I guess it's just in our body. But nowadays, I was looking at a research that says that sometimes after they take out your appendix, you have a lot of stomach issues, and that's because they took out your appendix. So they're discovering that we actually need it in our body. But like people think, oh, we don't need it, so it's fine. They're just taking it out. And in some cases, it needs to be taken out because they're in pain. And but back in the days, I feel like people just like, oh, you don't need it, you have appendicitis, let's take it out. But now, like, they're realizing that everybody that got their appendix out is having a lot of stomach issues. And my husband does too. Anyway, that's not the point. And it's not a fun fact, but I remember that my cousin, so this is just like a little story, like probably like a Mexican way still. But I remember my cousin got his appendix out like really young too. He's like 15 years older than me. Anyway, my mom used to tell me all the time, like, if Mexicans like to eat spicy stuff, and she would like tell me, if we eat a lot of spicy stuff like sauce, takis, hot Cheetos, all of that bad stuff, um, you're gonna end up like your cousin, like with appendicitis and having to have surgery and all that. But I don't know if that's true, but it's a fun fact. Well, not a fun fact, but like a story that just like was like a reason too for me choosing this disorder, I guess. So I will see you in the next video. Have a good day and enjoy your 4th of July. Bye.